Welcome to Pelvic Confessions. I am Dr. Carrie Howe, joined by my co-host and business partner, Dr. Jean Sharakarad.
Welcome to Pelvic Confessions. On this show, we have conversations regarding women's health and pelvic health that women don't often have, but really should
Yeah, each week we will talk about a different topic in pelvic health. Hopefully we're preventing your pelvic floor issues.
have.
We present these
Both.
topics as confessions, oftentimes sparked from conversation that I'm having with
Mhm.
women in the clinic, or some tips and tricks for some pelvic floor health along the way.
We're going to take a sharp U turn today.
Mm.
We're going to do my confessions today. How
Ooh.
about that? How about that?
How about
um, her last name's Sam. That's fine. So in Restore in the Restore Pelvic Physical Therapy in our business, Carrie's the clinician. She treats people, and I work on the business side of things and answer phones once in a while. So if you've called, you've probably spoken with me. One of the most common questions I get is, "Do you take my insurance?"
Mhm.
And and it's an important question,
Yeah.
right? Financials are so important when dealing with healthcare. Um, and we do not. And in the terms that most people are assuming is,
Sure.
are you in network is when they really ask the question of, do you take my insurance?
Right.
So on this episode, we're going to get into the conversation of insurance
Yep.
and why we chose not to deal with insurance and what insurance is and some of the logistics to that. So I'll talk about the business side of things. You can talk about the health provider
Yep.
side of things, and then hopefully make sense to everyone that's watching of why in network, out of network exists, and how it affects clinicians and how we can provide care as well. So let's start from your perspective.
Yes.
Why do you feel like insurance is potentially a hindrance in delivering clinical care?
Yeah. So, from a clinician standpoint, oftentimes when you are contracted with insurances and providing services to your clients, there are regulations and
Limitations.
restrictions,
Yeah.
yeah, quite frankly, on how you operate and maybe what kind of service I can provide or what kind of codes I am using and billing for. So, from my standpoint, to um, not work under in-network insurance.
Mhm.
I have a little bit more freedom. I have a lot more freedom, quite frankly,
All the free.
in terms of how I can practice, how long I can see my women for, what I can see them for, and I feel I am able to treat them as best as I deem necessary rather than having rules and regulations dictate what I can and cannot do with them.
Yeah. And I think that's important that it's it's called the practice of medicine for a reason. And again, kind of similar to what we touched on in the last video where we talked about the benefits of pelvic physical therapy or what a physical therapist is, this isn't about versus. This is
Right.
not us versus in-network providers. This is more about why we chose out of network and why that
Sure.
works for us. There's plenty of clinicians that practice in network and
Yeah.
make it work and still deliver quality
Yeah.
care.
And it's important to make sure that healthcare is accessible to everybody, right?
Mhm.
And so again, this isn't a out of network is better than in
Right.
network. It's just certainly our kind of personal mission and decision as to
Mhm.
why we are operating as such.
Yeah. So it's about the approach. So the freedom to treat is really important, right? And a lot of times that comes down to time. That
Yep.
when you're in network, it's tough to have a lot of time allocated to one person,
Right.
which is something you were very passionate about when we were creating Restore. One of the top things you said is, I want space for women, not just the physical space, but
Yep.
the space within time to give women the time that they need to have the conversations, to have that, because you can't bill that. That's
Yeah.
not billable time, right?
Yep.
You can't bill to your insurance company, we had time to talk,
Right.
right? That's from a business standpoint, that just doesn't happen,
Right.
right? But that was very important too.
Yeah. From a clinical standpoint, again, when we're dealing with pelvic floor concerns, These issues are very intimate.
Mm.
Women are at a very vulnerable state walking into my clinic every day, and that's something I don't take for granted. The last thing I want to do is for these women to feel rushed or to feel like I have to kind of get to the next part just to get them in and make
Yeah.
sure that we are able to cover everything that we want to cover. And so giving women the time and space, I am not limited to a 30-minute or 45-minute treatment. My first sessions with these women are, up to 75 minutes, with the follow-ups being up to an hour. And so that's really important for me in terms of treatment.
Yeah, and I think it's important when um, when you come in as a patient to feel like there is no rush, right? That there's not somebody behind you, um, at least for the women that come in to see you. So I
Right.
think that that transfers over to that consistency of care. Um, the other piece of it is, I mean, we get that financials are important.
Yep.
They're important
Yep.
for everyone. Um, so from a business standpoint, one of the conversations I quite often have is one educating, right? We
Yeah.
talk about education as a big piece of Restore. You talk about it from a clinical standpoint, but it's also important from an insurance standpoint.
Insurance is confusing.
It's
It's
incredibly
confusing
confusing.
for providers. It's
Yeah,
confusing on a personal
yeah.
level.
Well, it's confusing for a reason because that's part of their business model, right? It's supposed to be confusing because when something is confusing, you ask less questions because you're just like, whatever, I'll just deal with it. So one of the conversations we often have, so if you're a patient here and you've called before, you most likely have had this conversation with me, is we call your insurance company, we check in, and we get a breakdown of your benefits, which I'm sure you probably have seen at some point
Mhm.
or another. Oftentimes called an EOB or explanation of benefits. And most insurances have in network and out of network
Yep.
coverage. What makes things even more confusing is there's subsets of insurances, there's different groups, there's different purchases. If you have insurance for your work, they usually have a separate deal that they agree on. So there is no consistency,
Right.
which makes it an entirely confusing. So if you like imagine going to Safeway in one town, going to another Safeway in another town, and everything is different.
Sure.
All the shelves are all over the place. That's kind of like insurance companies. So one, we can't say if somebody calls and they go, I have care first, do you
Mhm.
cover that? We can't say sure because all care first
Right.
cover that. We have to look into that. But what pretty much everybody has is a deductible.
Yep.
And that's the first barrier, right? That's your first number that most people need to know. And most insurances in network and out of network have this deductible. And that's essentially your buy-in that you have to cover this amount, whether you're getting charged copays or not, you will be paying your deductible one way or another. And that's usually the biggest number
Yep.
that we have to deal with. And here's the shocking thing, the surprising thing for a lot of women is your plan might have an incredibly low deductible.
Right.
We've had plans that
Yep.
have zero deductible, $200 deductible, something that again low is relative,
Sure.
but it's marginal to what you think it's going to cost.
Yep.
And then your insurance might cover 70, 80% of your cost, which in essence turns into very similar to what in network is. Um, but it's confusing for a reason and it's cumbersome. We try to make it as less cumbersome as possible
Yeah.
by laying out that for women because it makes a big
It
difference.
does. Yeah. And I think, the courtesy that we offer again with the benefit is we have Jean to be able to look into all the details for you and explain it to you. It is confusing. So it's helpful for you to know exactly what you need to be looking
Yeah.
at, right? From a clinical standpoint, too, I do want to kind of make the differentiation. I think oftentimes when people think of physical therapy, if they have previous experience with traditional physical therapy,
Mhm.
usually the model that will be followed in terms of treatment is something like maybe you're going twice a week for 8 weeks.
Right.
And so when people start kind of using that model and adding up our numbers, that is a large chunk of cash
Sure.
for a service. However, how we operate at Restore is my average plan of care for women is somewhere between 8 to 12 total visits,
Mhm.
and that's usually spread over the course of half of a year. So I'm usually starting my women off after their first initial assessment. We might follow up in a week and a half, and then we start to stretch those out as the women are getting better control and awareness. And a lot of what we do is teaching them in the clinic, and
Yep.
then they're going home and practicing that. And so again, I think it is helpful to recognize that that fee for service is not going to be this large chunk of money, as sometimes people think that it is.
Yeah. Yeah. And to touch further on that, um, one of the frustrating pieces for me when we were talking about restore and conceptualizing it is when you go to healthcare or when you have a medical appointment and you pay your copay and then you might get a bill
Yeah,
for a few $100s and you're like, this was never discussed. Like you never have a sense of knowing exactly what's being charged or what you might be billed after the fact. And that's something we wanted to deal with. Um, so you knew what you were being charged from the start, and then you can get reimbursed and recoup that amount after the fact, and just flip that, right? That the most you're ever going to pay is like knowing exactly what you're going to pay,
sure.
and then it's only getting money back after that versus flipping it the other way around,
Yeah,
which is traditional, where you pay a little amount called your copay, and then who knows what you're going to get
right,
after the fact.
right.
So we provide a full breakdown and say this is literally what you're paying,
Yeah,
no more. At the very least, you're going to get money back, never more from us. I mean, the same analogy, right? Like imagine going to the store and saying, "I'll take that blender," and they give you the blender, and you go, "Okay, now it's going to be this amount." You're like, "What? What do
yeah,
you mean it's that amount?" So knowing is very very important, and we provide that certainty so that you know exactly what the price will be, and by doing the checking in with the insurance company for you, then you know how much money you'll get back as well. But one more thing before we change topics. If somebody has in-network care
yes,
and they're going to 16 to 20 visits and they have a $40 or $50 copay, that's going to add up very similarly to
yep,
a course of care that we see, not even counting the reimbursement that they get. Again, these are all numbers that we will work through with you. Um, but it's tough. It's a very oftentimes emotional conversation of
sure it is,
frustration
sure it
of
is.
why do I need to pay more when I already pay so much money for my health insurance
Yeah,
through work or otherwise? And we get that. We get that because we're the same, right?
yep,
We have health insurance as well for different things.
yep,
We pay on a network for certain things as well, but that's that's a decision we make.
yep. Yep. And much like you said, we certainly don't want to discredit the impact that finances play on overall health as well, right? Again, many of these women are seeking out care during a very vulnerable time in their life.
Yeah,
I keep coming back to that word vulnerable,
yeah,
but finances can certainly play a role in that. And again, that's where I, even as a clinician, am more than happy to have. I have had these conversations with my women of if they express that concern, we work around that. Maybe we're scheduling once a month, or maybe we're doing a 30-minute virtual visit
hmm
check in. There are ways that we can help, establish a plan of care that is conducive to your needs and
yeah.
also financial needs.
Yeah, I mean that's the benefit of being a out of network, small, flexible practice is
Yeah.
that we can truly focus on you, our patients first, and then work around the financial logistics because it should be do what's best for your health and then look at the financials. And that's the reason we're out of network so
Yep.
that we don't have to go, what do the numbers look like, and then go the other way. Again, there's companies that make it work, but we didn't. For us, it was not a topic that we even wanted to be top of mind when treating women.
Yep.
So, biggest point here is if you have questions, whether it's with us or other out of network providers, give them a call. I
Yep.
promise you, every single out of network provider will have a system in place to work through the numbers with you and give you a clear breakdown of what all that looks like, and maybe even a comparison to in network, because that's we do that all the time. We provide both. Here's what your out of network benefits are, here what your in network benefits are, and here what the comparison of costs will be over a course of care that's very similar.
Yeah. They can access that right on our website, right? Yep.
Yep.
We have a form right on our website, restorepelvicpt.com. You can log on, you can submit your insurance information, not have to talk to anybody to figure out what you need to do, Gene will give you a call once you submit it, and he can break that down for you.
Yep, exactly. We'll have this entire breakdown. We call that our we do an insurance pre-authorization, but our transparent billing. So we want you to see exactly what is in front of you if you decide to move forward with your course of care.
Yeah.
So, like Carrie said, if you have any questions or you want to know about your insurance, head over to restorepelvicpt.com. As always, you can head over to Instagram at restorepelvicpt or our YouTube page at restorepelvicpt as well. Very consistent. If you haven't yet, you could also check out our blog. It's also on restorepelvicpt.com. We have a lot of cool articles coming your way with some little videos in there as well. If you have any questions, give us a call or head over. Otherwise, we'll catch you again for another episode of Pelvic Confessions.
Let's not forget
New
new
mugs!
buds. Happy spring.
Cheers!
Cheers.
Funny.